What does blood and urine test results mean? Imagine going to the doctor for a routine checkup and learning that your urine test shows blood. That can be surprising, but it's actually a common finding that needs careful evaluation. Blood in the urine, known medically as hematuria, means there are red blood cells present in your urine. This can happen for many reasons, some harmless and others that requiring medical attention. Hematuria can be visible to the naked eye, which is called gross hematuria. If your urine looks pink, red, or reddish-brown, that's a sign of gross hematuria. Sometimes, blood isn't visible but can be detected under a microscope or with a dipstick test during urinalysis. That's called microscopic hematuria. When blood shows up in urine test results, it often points to something happening somewhere in your urinary tract. The causes can range from infections to more serious conditions. For example, urinary tract infections are a common cause. They can cause inflammation and bleeding in the bladder, kidneys, or prostate. These infections are usually treatable with antibiotics. Kidney or bladder stones can also irritate the lining of your urinary system, leading to bleeding. These stones are hard mineral deposits that can cause pain and damage as they move through your urinary tract. Blood in the urine can sometimes be an early sign of more serious issues like bladder or kidney cancer. This is especially important if the hematuria persists over time or occurs alongside other symptoms like pain or weight loss. People with risk factors such as smoking, exposure to certain chemicals at work, or a history of bladder problems should be particularly vigilant. Other causes include trauma from injury, benign prostatic hyperplasia in men, viral infections, or systemic diseases that affect the kidneys. Sometimes, what looks like blood might actually be caused by foods like beets or rhubarb or certain medications that change urine color. If blood is detected in your urine, your healthcare provider will want to do more tests to find out why. This usually involves a detailed medical history and physical exam. Repeating the urinalysis and examining the urine under a microscope can help confirm the presence of blood and look for signs of infection or other abnormalities. Imaging tests like ultrasounds or CT scans may be ordered to check for stones or tumors. A cystoscopy, where a small camera is inserted into the bladder, can help visualize the inside of your bladder directly. Additional blood tests might be needed to assess kidney function or look for systemic conditions. From a bladder health perspective, it's important not to ignore blood in your urine. While many causes are benign and easily treated, hematuria can sometimes be an early warning sign of bladder cancer. Early detection improves the chances of successful treatment. If you notice blood in your urine, even if it happens only once or without other symptoms, it's essential to see a healthcare professional promptly. They can determine the cause and recommend the appropriate next steps. Remember, each person's situation is unique, and only a medical professional can provide personalized advice. In summary, blood and urine test results indicates bleeding somewhere in the urinary system, which can be caused by infections, stones, or more serious conditions like bladder cancer. Proper diagnosis and management are key to maintaining bladder health and catching any issues early.